Perfectly. What can I believe?
Happy Advocacy Day, everyone. My name is Sean Latham from Self Advocates in Leadership, or SAIL. My visual description is a white middle-aged man with a gray
With a brown thread on.
on. I have a picture of the SAIL logo and SAIL members in the background. Today's you will hear about why our workforce is so vital for us as people with disabilities and our families. We believe that providers in many different areas make it possible for people to live in the community. We all desire to have a high-quality workforce that assists those with intellectual and developmental disabilities, and you will hear about that today. Just a few reminders today. Please use the Q&A box for any questions you have today. It can be found in the More menu, depending on how you are accessing Zoom. We would prefer you only use the chat today, for only the important links and for those that need it for accessibility reasons. We again prefer you use the Q&A for questions, and we encourage you to avoid long discussions in the chat, because they can be distracting. We also need you to click on the globe icon today, in Zoom, and select if you want to hear today's program in English or Spanish, as this will help with our interpretation services. And it helps all of us hear each speaker clearly. And then lastly, we want to encourage all of our speakers today to speak more slowly, so that our interpretation services correctly relay your words. With that, I will pass it to my fellow MC today, Emily, to introduce herself.
I'm with you on it. Yeah.
Thank you, Sean. My name is Emily Rogers. I'm the Director of Public Policy for the DD Council, and really happy to see you here today. And thank you for coming, and thank you for continuing your advocacy. And I look forward to some great speakers and sharing of great information. Thanks.
Thank you, Emily.
Our first speaker of the day is Kathy Muraashi, from the Arc of Washington, to give us an overview of today's topic.
Welcome, Kathy.
Thank you. Good morning, everyone. Welcome. We appreciate you being here. Today's topic is protect our workforce. How do we ensure that there's a quality workforce available to provide care? And this is just a really high level, things that are important, big picture. So we know that Washington has a workforce shortage. If any of you have tried to find providers, you know how difficult it can and challenging it can be. And it's not just, it's not just personal care providers. It's finding behavioral and mental health providers, child care, and early supports. In education, we don't have enough special education teachers or specialists. Home care and residential services for, our direct support providers and individual providers. It's difficult to find respite care providers and for recreational providers and healthcare providers and employment providers. So it's all the things, all our stuff. It's difficult to find providers, and we have a shortage. And when we don't have enough providers, it causes crisis. When we don't have the care we need, we know that people end up in bad places like hospitals and emergency rooms, jails or institutions, or in the worst case scenarios, they end up homeless. And all those things cost way more money than to just provide the care that they need in the first place. And for families, the impact can be that they may have to quit their job to care for their loved one. Or, they can also, sometimes families have to they end up breaking up because of the stress. And so people don't get the care they need. And very worst scenario, when they don't get the care they need, sometimes people die. And that's just really bad. And that's why workforce is so important. So what do we need? We need investment in the training of the workforce, in recruitment. That means going to find people that are willing to do that and tell them why this is a good idea, and find ways so that we retain those people once they are hired. It's like, how can we keep them? And, what they need to be able to do that is they need the training, but they also need to make sure that they have adequate wages, that they're paid well, and that they have benefits. It's bad if people provide a benefit to you, a service to you, your therapist, and they don't have benefits themselves. If they don't have, health care or other things, they need those kinds of benefits too. And really important is most of our services are Medicaid based, and we have to be sure that those rates are high enough to actually cover the cost. Oftentimes, Medicaid rates are, providers actually take a loss when they provide Medicaid services. I can remember talking to my daughter's pediatric dentist years ago, and she says, it costs me more to bill Medicaid for the dental procedure than she would actually bring in just to bill, not even to provide the service. So we know that Medicaid rates are super low, and that those need to really have a robust workforce. That's something that we need to continue to do. And we know that probably this year is not going to be the year that happens, but it's something we need to continue to talk about and educate legislators on. So I think with that, I think I can stop sharing, and you can go to your next speaker.
Now it's my pleasure to welcome Sierra James from the Whitcomb Center for Early Learning, who will be addressing the challenges in early supports for infants and toddlers.
Welcome, Sierra.
Thank you for having me. My name is Sierra James. I am the Executive Director with Whatcom Center for Early Learning. And should I share my screen, or do you have the presentation already?
I think you need to share your screen. Let me see if I can. I'll make you a co-host, and then you can. There you go.
Alrighty. Okay, let me just get it. Sorry about that. All right, here, now people have visuals. I know I'm a visual learner, so it helps me. So early support for infants and toddlers. So we work with the 0 to 3-year-olds that need support for all sorts of different things. Kids coming straight out of the intensive care unit is a big one, as well as all sorts of different diagnoses. We are in a situation where it is very difficult to find the folks that we are wanting to have to work for us, that have the identities that would really be helpful for us. So we're an ESIP provider here in Whatcom County, but there are similar agencies all across the state of Washington that provide these kind of supports for 0 to 3-year-olds. Let's see. Can you all see? You're seeing my slides? Yeah. Okay. So examples of the type of staff that we need are occupational therapists, physical therapists, feeding therapists, speech language therapy, and developmental specialists, which are educators with special ed degrees. And it is quite difficult sometimes to have the resources, like we're just being spoken about, to actually be able to hire these folks, because they can get better benefits and summers off at the school districts at times, and in other and other jobs. And so we really have to kind of try to be competitive to be able to get really good people into these roles. The ESIT system is underfunded and providers are struggling statewide. And then just this year, we have been in a situation where we have had to fight really hard because they were threatening a 17% cut, which would, for our agency alone, be like $700,000. And a lot of people would lose their jobs. And more than that, a lot of children would lose their care. And luckily, that budget didn't make it in, but there's still a risk that it will move forward to delink 0 to 3 services from the services of 3 to 5 year olds in schools. And if that happens, they'll probably be looking to cut us next year. So we really have to keep up the advocacy. We really don't want the state balancing their budget on the most vulnerable populations, kids and people with disabilities. So we're really trying hard, like you all are, to fight against that. So what is this workforce? So our ESIT staff are early childhood development experts of all those types that I just said. Most of them have master's degrees, PhDs for the physical therapists. And that makes it difficult for us to find them, to retain them, for all the reasons that the last speaker talked about. In addition, it's incredibly important that we have people who come from marginalized backgrounds so that they can relate to the families that we serve. So whether it's BIPOC staff, multilingual staff, staff that have experience with disability themselves or in their family, and other historical marginalized populations. Right now, we have very few in the workforce that actually have this background because it is extremely expensive and difficult to go and get these specialized degrees. And so what's happening is that we don't actually represent the communities we serve as much as we should, and that impacts the ability to provide these services as well as they could be provided. So this is the bill that has been put forward in the House. It's 2688. It would have that 17% cut. We strongly oppose this bill. We've worked really hard to stop it. And right now, it has not gotten into the budget, but that doesn't mean that it won't go forward in any capacity. We think that the first piece of the budget, which links the multipliers with the special ed multiplier, would potentially be delinked, which would mean they could unfund us in future years. So we're still really trying hard to talk with legislators and advocate on this piece that is really important. This is the foundation of the special ed system. We pass kids at 3 off to special education. And so if this gets defunded, it will mean more kids will need more care as they grow because 85% of brain development happens before 3. And therefore, there's so much ability to have an impact at this age. And if we aren't able to do that, then it will mean more costs in the long run. I actually think that must be the last slide. Thank you so much for hearing me out, and I hope you all are really successful with your advocacy. This is really important stuff, so thank you all for all your work.
Yes. Thank you for that. Hopefully this will hang over the next one.
Next, I want to introduce Jim Mancini and Katrina Davis from Washington Include Collaborative, who will be addressing training professionals.
Well, thank you, Sean, and thank you all for inviting us. And I'm not, it's more than just Katrina and I. I'm going to have Shantae Johnson, Samantha Hinger. Why don't you guys raise your hands? And I have got to change this view because if I look at myself the whole time, I'm going to mess it all up. And that is just not what we want. So, well, hello, everybody. And I've got some slides too, so I can share my screen as long as I've got permission. And
There you go.
Quick. I'm going to be quick. All right. Let me see. This one, slideshow, play from start. All right. You guys can see this. Shantae, give me a thumbs up. Awesome. Great. So hello, everybody. My name is Jim. I'm the director of our Washington Include Collaborative. Include stands for the Interdisciplinary Network of community leaders with a focus on underserved and disability education. And I'm assuming that means every one of you is who are here in the room are part of our community of effort to try to do better to support our community of folks with intellectual developmental disabilities, mental health conditions, and the intersection of the two. So, and our goal, and I see lots of familiar places. My plan for today is to kind of give you a real overview and just kind of, and I'm not going to go through all of these things. I'm going to mention a couple of things, and then I'm going to pass it on to Shantae, Samantha, and Katrina to tell us a little bit more. Three of the best moms I've ever met, by the way, the three of them. So you want to hear from them. So our big efforts around our state is to build community. We've been only around for 6 or 7 years. And our biggest success is our outreach that we have made. We are a statewide program, and we have representatives from, I think, every county in the state who joins some of our programs. When COVID hit, we were all virtual from the beginning, so we didn't even skip a beat when we got locked down. So you might have heard about ECHO programs. I'm going to talk a little bit more about those. That's the kind of bread and butter of what we do. But we're also responsible for the Autism Center of Excellence training. This is a contract with the Healthcare Authority to train providers. How can you to be able to access the diagnosis of autism and to be able to make appropriate therapies, like therapies around applied behavior analysis. So I'm going to move quickly through these. Here are all of our ECHO programs. The website will be here. If someone can throw the website in there. There's a lot that's going on. So you can see that we are focused around the diagnosis of autism and especially focused around this intersection of mental health and IDD, which has been overshadowed for too long. Right? It was in my career where behavioral health agencies were not taking kids because they had a diagnosis of autism. And thankfully, our systems are doing better with that. So we've got a long way to go. Project ECHO is a worldwide program that is around teaching providers, and again, I'm not going to go through all of these things, but we know we don't have enough specialists to treat everyone, especially in our rural areas. So this uses a case presentation model to be able to provide information about specifics, using the case as an example. It is how most of us have learned, throughout our careers. And here's just a little example of the community impact that we've increased confidence in recognizing, diagnosing, and supporting individuals with autism and IDD. Knowledge of best practice and resources. We've increased the number of diagnostic evaluations completed and the understanding of the complexity that often goes into these cases. There is still work to do, right? And we are looking to decrease perceptions of barriers, decrease feelings of isolations, decrease referrals for evaluations to the Autism Center, because we want people to be seen in their home communities, by providers who understand their communities, their local culture. So, a couple of comments right here since we're talking about the workforce. I'm a speech language pathologist. I work within a very interdisciplinary group of people. And what I have learned over and over again is that our training does not provide us with an opportunity to learn about autism, learn about IDD, and learn about the intersection of those with mental health. All of us kind of learn in a silo, an ableist system, for that matter. So we have a lot of work to do. Most of us are not having the opportunity to learn interdisciplinary. How does my role jive with the role of the prescriber or the ABA provider or the occupational therapist or the educator? It is a village that we all need, to be able to put and do this work together. Other things that are problems is that that very often to get more training, and this is a problem in our especially in our eastern part of our state, organizations require you to take PTO to join our programs or to continue to do additional training. So you're not getting paid to learn how to do the work that you need to do. So so I'm going to pause there, and I wanted to make sure I gave time and space to our three great moms who are here on the call. So I'm going to stop sharing. I'll bring this back up later. Shantae, can I pick on you first to talk a little bit about what do you see as our role in this work?
Hi, everyone, and thank you, Jim. Absolutely. My name is Shantae Johnson. I'm a former educator, homeschool mother, also a mother of a child with awesome autism. You hear me? Because that's how we speak about it in our space. The beautiful thing about WA Include is just literally the word include. How I came to be even in the program was I was a Lynn trainee, and I got a chance to speak about my experience as a mother and caretaker of my child who's teaching me about what the world looks like. And I am just his interpreter, right? And I don't do necessarily the best of jobs because who knows all the complexities and intersections that he gets to express. But Include also has this amazing ability to tell the stories of those that don't have the voice in which they get a chance to speak. And so just to see like Stacy on the call, we just had her at an Echo. So in the chat, I decided to put some history of who Echo is and where we come from. But also I'd love to talk to you guys about the website that we built that gives you more information and resources about Echo. I get a chance to coordinate for these Echoes, particularly wraparound. But all of my colleagues do a fairly amazing job of bringing didactics, information, as well as case presentation that are intents that you might need help with. And so again, it's not only giving us an opportunity to learn in these spaces, but it's also that multidisciplinary opportunities to be able to learn, right? Because there is not a space where sometimes a person that has the intersections of being a mother, but also having this background in autism and the medical work come together to be able to express yourselves in those multiple ways. So if you ever have a chance to visit our website, please do. And if you ever have any questions, I'll make sure I'll put my information in. But the biggest thing is just remembering our name about Include, because that is our job. And if you don't feel included and you don't know information, we're not doing our job well. So I'm gonna pass it. So hopefully that was like under a minute.
That was great.
Give you some more.
We're killing it. Samantha, are you ready to go? Can you go next? And then we'll go to Katrina, who's AKA Kathy Murahashi today.
Hello, everybody. My name is Samantha Hinger. I am a number of different things. I am an ADHD human. I have multiple neurodivergent children with, a variety of support needs. And I've been working in the disability space since I was a teenager. So I started as, a contracted caregiver. I was a DDA, now DDCS case resource manager. I was now a developmental disabilities and mental health program consultant as well. So I have worked in this space for a very long time, and it's something, near and dear to me. I came into, my neurodivergency in adulthood, and in learning so much more about myself, I've learned so much more about the gaps within our systems and the, lack of support that is really out there for humans with intellectual and developmental disabilities, and across all support needs. These resources are just really not available for any of us. And so that's, something at WA Include that we're really trying to build on. We're really trying to provide that education and including voices of lived experience, neurodivergent parents, neurodivergent humans, into the space to share our experiences and share what it actually is like to be a neurodivergent human. Because I can tell you from experience and also obtaining education on these things that there is a lot of misinformation and a lot of, old information out there that we are working on, updating and providing new things to people about. So thank you for having me today.
Awesome, Sam. Thank you. Katrina, I'm going to give me 1 minute at the end.
All right. Katrina Davis, proud parent of a high needs young man, and WA Include program resource navigation specialist. I also work at Seattle Children's and their emergency department, helping our IDD population navigate crisis. The we're here today to talk about the importance of capacity for our workforce and the need for a high quality workforce. And I think the role ECHO plays in that, or WA Include plays in that, is they use an all teach, all learn strategy. So people feel more empowered and involved in the learning. Excuse me. This is something really unique, I think, and something we all value, is that the program leads with compassion, grace, creativity, and a proactive and hopeful approach to the challenges and the gaps in our systems, and what's facing our IDD community. Lived experiences at the front and center, represented by self-advocates, parent advocates, and the culture and the values encourage these models, that they're a model of having difficult conversations, which I think what we need more and more, to be able to have those conversations in a facilitated and supported environment. Lastly, the platform identifies chronic gaps, like Samantha says, and I know you all love that, because we can help you. We can bring stories to you, and we have stories, and we want to share them, and we want to help you advocate. And we bridge these systems of care to, we got DDCS in the room with Healthcare Authority, with DCYF, with providers, special ed, advocates, community agencies. And so it's building that connection. And I'll just close with, we are here to support you. Go to the website, check it out. And we value your input, your feedback, and your involvement. Thank you.
Way to go, everybody. So, things that we hope to do, continue to do, is to continue to build this statewide community. When you get together, you find your people, right? And I think that what we've learned is that there are people who have been really isolated across our state, and building the connections allows us to keep full. How many people in our workforce have left because they're burnt out, right? And I think that one thing that the kind of secret sauce to ECHO is the community, that you show up and you feel like, hey, I'm supported. I'm not alone in doing this. The case that's presented gives me ideas about what I can do. And the people I get to meet are the champions of our state who are doing this work, who are on the front lines across disciplines and across systems. So we want to try to create more support. One of the things that we're going to be doing this year is, we're really interdisciplinary. We also are going to get kind of tight, and we're going to work on speech language pathologists or occupational therapists or the ABA providers. How can we build those communities up together so that we can also include a focus group or a consult group around those areas? And finally, we are really doing specific outreach to underserved communities. We're working with the Tulalip tribe right now. We are working with others. One of the ideas that we have had is to connect with some of our groups around the area, the VFAB, Vietnamese Family Autism Advisory Board, or CARES, the Chinese autism, and I'm not going to get that acronym completely right. How can we support them? And how do we find the people who are going to come into the field? Siblings, right? Moms and dads. There's a reason Katrina and Shantae and Samantha are in this field, because they have the personal connection. How can we maximize that? How can we do better care coordination, across our state? Because that is often where the crisis cases fall. Right. And then finally, we are working with, since we're at the University of Washington, we are working with our departments in medical school, speech, OT, to be able to support the training and the education of all those people. So we're out of time. Thank you so much, everyone, Stacy and Kathy, for having us. We'll stick around. Come join us. Please come join us. I'm going to put all of our emails. If you have more questions, reach out to Katrina, reach out to Shantae, Sam, or me. Thanks all.
And hi, Pam. We miss you. I had to say that.
Hi, Pam. I miss you too, Pam.
Hi, Pam.
Hi, you guys.
Thank you so much, Dr. Samantha and Katrina, for the wonderful presentation. So thank you. And our next speaker.
Our next speaker is Amal Grabinski from the Community Residential Services Association, who will be addressing workforce challenges in supported living.
So welcome, Amal.
Awesome. Thank you, Sean. Unlike my colleagues who are so vastly more prepared than I am, you just get to see my face while I'm talking, because I did not put together a presentation. I could give you lots of reasons for that, but I'm not going to. We'll just say I was really busy doing other stuff. But So my name is Amal Grabinski. I am the Chief Impact Officer for ProVale. I'm also the immediate past chair of Community Residential Services Association, who many of you know. This year's CRSA's legislative agenda asks to reduce red tape in the delivery of services and to protect the right to community living. We all know this is in recognition that it's not a year to ask for more, but to ask for us to remain whole so that we can continue to support disabled individuals. Now, luckily, our bills seem to be moving through the process well, but we're all a little bit on pins and needles until it's done. I know that I am not the only one that feels that way. So to talk a little bit about direct support, it's a role that's critical in ensuring the Olmstead Act is put into practice for disabled citizens. Statewide, there are more than 11,000 individuals who work as DSPs in a variety of settings, DSP being direct support professional. Primarily in supported living, those 11,000 human bodies provide 21 million hours of care per year. And supported living services are delivered 24/7 as defined by the individual. 87% of the individuals with the highest level of care needs in our community receive their services through supported living. So it is a big program that has a lot of impact in our community. So we know that when caregiving and direct support services are funded appropriately, disabled individuals can flourish. So currently in supported living, we're only funded at 90% of the cost of actual services. Now that has to cover things like pay, workforce benefits, like health insurance, paid time off, the cost of doing business, the cost of training, the cost to hire individuals to do HR and accounting, all of those things. Those are all part of the cost structure that we have to cover. Bluntly put, when we aren't funded adequately, we don't have room to increase pay the way we should be able to. Lower pay leads to high turnover. For the human experience, it causes the loss of trusted, trained, and valued staff, and it disrupts people's lives and their ability to move forward in their lives, which is, not something that we should be able to sustain as a society. If you go back in time, in 2020, supported living got an amazing rate increase. Many of you in this room advocated for that, and I think we're all incredibly grateful. That increase took us from 75% turnover during the pandemic to the current 57%, which doesn't sound like it's really a lot to be proud of, but it is a discernible change. Unfortunately, that 57% is still in the highest 25% of states for turnover. So we're not meeting the mark here in Washington. Now, again, going back, when we got the increase, bluntly, within weeks, caregiver pay was already inadequate compared to the rising cost of living. And just to defend, I guess, overturn a little bit of bias, that's not just true in Seattle. That was also true in Vancouver, Spokane, Yakima, Bellingham, inadequate compared to the cost of living everywhere in this state. We know that care work is societally devalued. And we know that the majority of this work is done by young women of color who are already disproportionately impacted by social policies. Caregiving deserves to be a respected, professionalized career path with pay to match, reflecting that care work matters to keeping our communities whole. When caregivers can't afford to live in the communities where they work, when healthcare has become too expensive to afford, or when caregivers have to work multiple jobs just to make ends meet, we know that our systems aren't working to support caregivers or disabled people. It is unacceptable that citizens who require support are bearing the consequences of a lack of long-term funding to keep our caregiving systems funded and whole. I believe Washington can do better. I appreciate you guys letting me speak on behalf of our association, and I am always open to questions, comments, separate emails, debates, all of the above. So thank you so much.
I'm thinking about, oh,
So next I think we'll have Debbie Myers from SCAC talking about workforce challenges for supported employment.
Okay, I'm off mute. So, and I want to apologize. The grounds crew just showed up and they're right outside my window, so I hope you can hear me okay. I apologize for that because I know this is being recorded. So I will also pull up my notes and you will get to see me during my talk. But thank you for having me today. I'm Debbie Myers, Executive Director of SCAC Employment Services. We provide supported employment and community inclusion services in King County. I'm a 64-year-old white woman with brown hair and brownish glasses wearing a teal sweater today. I'm also a board member of the Community Employment Alliance, which is a member organization of employment and community inclusion providers. We advocate for and support quality services in the state of Washington. I'm here today to talk about workforce crisis and the impact we know this has on people with IDD receiving services and how we are advocating for changes. As you may be aware, employment and community inclusion services are authorized through Developmental Disabilities Community Services and contracted to providers through counties. Hours of service to support people come from calculations in the annual assessment case managers complete. Employment and community inclusion providers are paid for the hours we directly support people to find and keep their jobs, find and support community activities, and completing the required documentation. The rate providers are paid comes from the legislature and Developmental Disabilities Community Services calculations and appropriations. So even though rate increases are needed, this year we too did not ask for an increase. We asked the legislature to protect our funding for services and did not, we were hopeful not to get a cut as many other organizations or providers. In years past, providers have asked for rate increases due to the rising costs and rates have not kept up. In 2022, the legislature ordered a rate study for employment and community inclusion services that found provider rates are far below the actual cost of delivering services. The study identified what the rates should be to cover costs, meet staffing needs, provide training, and meet all the requirements. Since then, the state has made some increases, which we so appreciate, but we are still well below the rate study recommendations to cover our costs. So why does all this history and money talk matter? There's a direct link to provider rates below the cost of doing business for employment and community inclusion service providers and what is happening with staff turnover and longer wait times for people with IDD. Many providers are at capacity, making sure they provide the best they can to the people they are currently serving before bringing on new people to support. Providers want to pay our staff living wages, provide good benefits, and provide training to retain and develop our staff to ensure the quality services people deserve to be successful and at work and in the community. Many providers struggle with managing the needs while managing the financial side of things. Turnover is difficult for people served and costly for providers. Recruiting new staff into this field is also challenging for many of the same reasons. There are limited designed career pathways leading students to want to be employment consultants and community inclusion specialists. We continue to work to inform and develop ways for young people to choose this career. Good wages and benefits help students to see that there would be a future in this work. While the state of Washington continues to rank at the top nationally for supported employment outcomes, we know that's not enough. We know that we can do better and we want to do better to ensure everyone who wants a job has a job and everyone who wants to connect and be included in the community has that opportunity. Providers and advocates together are sharing how rates directly impact the quality and outcomes for services. We continue to advocate and ask the legislature and Developmental Disabilities Community Services to look for ways to increase rates to improve workforce stability and grow the opportunities for employment and community inclusion services. I want to thank all the advocates for sharing your stories of need and success, helping the legislature and government partners to better understand. I think we've had a recent some recent proof of why advocacy is working, or how advocacy is working, as the eligibility changes proposed in the governor's budget, which would be a cut to services, did not make it into the House and Senate budgets. I know it's not over yet, but we need to keep advocating because that is very good news and advocacy, and shows that advocacy does work. So thank you for having me.
Thank you, Debbie. Next we'll have Julie Clark
Emily.
telling her personal story.
Oh, sorry. I have a question in the Q&A. Is it okay if I share that really quick first?
Sure.
Okay, awesome. Sorry.
No.
Okay. The question is, I wonder what advocacy strategies folks are rethinking or imagining now and into the future beyond sharing stories, because it's so clear decision makers do not acknowledge the humanity of people with IDD and are making social policy and budgets to shorten life expectancy. Even trying to convince folks of the fiscal cost of not providing services is not convincing enough. The ableism is off the charts. That's the question.
That's a good question, and I think it's challenging. Even though it feels like our stories don't matter, I think they actually do in the long run. I think when you pair data and information with stories, it's more powerful. But I think that you also have to take a step back and it's like, this is the long haul. We have to keep continuing to tell our stories and continuing to give information and continuing to build relationships with those legislators. I think in this really dismal session or time where things are so bad, some of what I've see is oftentimes it's like, we know it's bad. We don't think this is a good idea, but I don't know what we're supposed to do, kind of a deal. And it's like, we have to cut somewhere. So I think we have to just be in it for the long haul. Stacy, do you have other thoughts there? Oops, you're muted.
Oh, sorry about that. I have a tricky mute button for some reason. No, Kathy, I mean, I think you've covered it well. We have to, our voices are being heard, and the kind of coalition building that's been going on in our community this last session is really working. And so we have to stay in contact with each other, and work hard to work out our differences behind the scenes, not in front of the legislature, obviously, and just continue to support each aspect of this really fragile system. I think, we've been talking about a plan, a long-term plan that would help us over time. And so if we could be thinking about what that might look like if we were to get the legislature to direct DSHS to do something similar to what they're doing in children and youth and behavior spaces, and what they did in the aging space over the last 10 years. I think that would get us through some of the politics of election cycles and short-term biennium budgets.
Yeah, this is Jen. I'll just quickly, because that was my question. That was me. And so I'm speaking as a parent of a teenager and with a developmental disability. So I just wonder about just pausing with that question. I don't expect answers, but clearly from my lens, we do need to rethink some things and have different strategies, because it is not, this has been a long haul for so many years. It has been a long haul for decades, and cuts they made last session, what they're doing now, what's happening at the federal level, these things aren't going away. So that is just my gentle push to ask people to just think with that. And, lastly, we all have jobs that are made up, and we live on this floating rock together. So it is a time when we can kind of think differently. And I'm kind of tired of begging for the humanity of my kid and many's like him.
Yeah. We feel you. We definitely feel you, Jen. It's a challenging moment, and I do think we do have to think how can we, what's the long plan? And I think that the thinking about having a long-term plan will help. It's not going to take care of all of that, but hey, and guess one other thing you guys can do. You can vote. So when the next election comes around, don't forget to vote for those that make a difference.
Mm-hmm. Yes, for sure. So are there other, I should ask, are there other questions? And then we'll move on to Julie.
This is Christy. No, that was it. Thank you,
Okay.
Emily.
Okay, sure. So now we'll have Julie Clark telling her personal story.
Good morning, everyone. My name is Julie Clark. I live in Olympia in the 22nd District. I have cerebral palsy and I receive supported living services through an agency called CoCua Services. I have been with CoCua for over 20 years. I had many caregivers. They would cook and clean. Back then, I was more independent. As my disability progressed, I needed more assistance with medical tasks. It is important to have caregivers who care someone who can work with me and my needs, including my feeding tube, vest machine, and higher lift. Caregivers should be reliable and on time, those who can get me out of the house and into the community. There is a lot of turnover in this industry. I have to train new caregivers. I get exhausted in training new caregivers. I need our state to support me by paying my caregivers well, so my needs are met. I do not want to see any budget cuts that would reduce my services and reduce my quality of life.
Yeah, thank you. Thank you, Julie, for your telling your own story. It's powerful for sure. We're grateful for you being here and continuing your advocacy. So next we have Deanna Winterrose, Benton Franklin Parent Coalition, talking about the parent perspective or family perspective.
Thanks so much. When talking about the family perspective today, I'm going to be focusing on the family providers and their desire to provide care for those loved ones and how that is being complicated by some political action. So just a brief history, the category of family provider was created with the express purpose of reducing the training requirements for family members who come to this work with a lifetime of experience in working with their loved one with IDD. The training requirements were reduced from 70 hours to 35 for that initial training, and all continuing education requirements were removed. The category of provider went into effect in July of 2023, and not 6 months later, the training partnership was back at it, asking the legislator to add back in the continuing education requirements that had just been removed. They succeeded, although with a slow roll-in. We were allowed to do voluntary continuing education in 2025 and 2026, and in 2027, that continuing education is slated to become mandatory. This year, in an effort to push back, we created House Bill 2337 that would allow that continuing education to remain voluntary. We believe that the status quo of voluntary and paid is working based on the data that we've received from DSHS. The bill was assigned to the House's Post-Secondary Workforce Committee, where incidentally 13 of the 17 members received campaign donations directly from the training partnership, a fact that will contribute ultimately to the failure of this bill. We immediately faced extreme pushback from the training partnership, who told legislators that allowing it to remain voluntary would cut off training. They even went as far as to communicate this to their members, knowing it was untrue. Family providers take 35 hours of training including basic skills, safety, and mandatory training. Plus, they would still have access to the 12 hours of continuing education every year, just like they'd been doing, voluntary, paid, and being able to take those classes whenever they related to the one family member they were caring for. Seeing the writing on the wall and concerned that the bill would die in committee, we proposed several compromises to reduce the number of hours required per year, to allow 12 credits to be required over 2 to 3 years rather than a single year, to allow training received directly from the client's healthcare providers, so think PTs, OTs, speech, to be counted in lieu of the prepackaged and often irrelevant trainings that are being offered through the partnership library. All the requests fell on deaf ears. The training partnership was truly not listening to the voices of the very caregivers they claim to represent. Finally, we proposed a simple date extension to postpone the mandatory effect to July of 2027 or later in the fiscal year, to allow time to gather more data on the voluntary paid hours being taken and more time for evidence of whether or not this model was truly working. This request was ignored as well, and the bill was allowed to die in committee. We also approached legislators about a proviso requesting that if cuts must be made that impact our clients, they instead allow family provider training to remain voluntary until 2028. This would allow a savings of more than $1.1 million a year. Republican legislators from the 8th District were willing, but given the current power dynamic in both the House and Senate, we knew we'd need a Democratic champion. Unfortunately, none of those we reached out to were willing to propose this proviso, even though it would be a cost savings. As a last-ditch effort, we reached out to the governor, requesting that he advocate between us and the training partnership to look for solutions that would satisfy both the training partnership and the family providers, and those requests were blocked by his staffers. The legislation dictates that mandatory courses be taken by family providers in 2027, and that those courses be directly related to the one family member we care for. Now, family providers like me who are unable to find 12 credits directly related to our loved one are faced with a decision. And this is a decision I posed to the members of the Post-Secondary Workforce and the Post-Secondary and Workforce Committee 3 weeks ago by email. Do we stop providing care because we can't find courses directly related to our loved one? Or do we take courses that are unrelated, breaking the law, in order to continue being allowed to provide that care and wasting precious resources that could otherwise go towards providing essential supports and services to our loved ones? To date, I have not heard back from a single committee member. I'm frustrated. I'm sure you can hear it in my voice and my testimony. We're hoping to find partners to work on this in the interim. The ARC of Washington was an advocate partner this year, and we were just shut down. That's all I have.
Thank you, Deanna. That's obviously something that we need to continue to work on and continue to educate legislators about why it's important. Thank you so much. Next on our agenda, we have Sean Latham talking about the impact on individuals.
I think I'll be going.
Oh, okay. Kathy's going next.
Am I going to go next? Okay, that's
Okay.
fine. Let me share my screen here just a second. So I think I'll go quick here. Share. So we're getting really close to the end of session, which is great. Session ends on the 12th of March. What's happened so far is that, the first cutoffs have happened. All the bills have come out of one house or the other, and they have to be out, let's see, by today, what they call the or policy committees. So it's like they've already, but the bills have gone, the House bills have gone to the Senate bills have gone to the House. Now from that side, they have to get out of those first committees by today. And then by next week, let's see, it's the second, next Tuesday, or no, the second is this weekend. They have to be out of the money committees. And there's not a lot of bills that have money attached to them this session. So a lot of them are going to skip right through the money committees, and then they're going to go to where they need to be voted on. So we're happy that a lot of our bills are making great progress. Let me go up here. So the preservation of records, 5863, that bill is already in rules to review, which is great. The renaming bill, for those of you who are interested, that renames certain RHCs, takes the word school out. That bill this morning was executed out of the committee, which is good. And it did have, for those of you who are curious, it did have an amendment that put Yakima Valley School back into it, which is great. 2350, the transparency for federal requirements, it had executive action taken. The community protection bill, 1390, got out of executive committee. And I know that bill's been a lot of work. So it's going to go, have next steps as well. So we're happy to see that move. Let's see. So today, in fact, just about this moment, and some people may be over there listening to this, 1795, addressing restraint and isolation of students in schools, is in committee, and they're deciding whether it moves along, whether it gets executive, whether they voted out of committee. Is Ramona here or Pam? Maybe you can give us an update. We understand that it's a little tenuous right now. They were concerned about amendments. Does somebody have some information on that? Ramona may be over there listening. So stay tuned. Sometimes go ahead, Pam.
Yeah, I don't have too much to update. I think you're right. We just hoping to get it through the Senate, but there may be some suggested amendments. We're not sure. So I'm sure she's listening in, and we'll keep everyone updated. Yeah.
So if that bill's important to you, there's that birth to 3 bill that we don't like. It's still there, and you never know what's going to happen. Hopefully we think it's dead for now, but things change sometimes, and we have to pay attention. The streamlining and monitoring bill, 2230, I believe it looks like the House bill is going to be the vehicle, and the Senate bill probably is going to die, and it's going to be the House bill. And the House bill had executive action taken. So those are our main priority bills. There's other bills here that may be of importance to you. A couple of them, most of them are still moving along. There was a couple bills, I think, that we were going to, in education, the high school and beyond bill, that bill is moving along. Let's see. The maintaining online records for special ed, 6268, that had executive action taken and is moving. There's some of these still have hearings to happen. Back down, let's see, the blue envelope program. I know some people were interested in that, about neurodivergent drivers carrying a blue envelope in their car that explains their disability if they're pulled over. It has a hearing in transportation tomorrow. I think the transportation deadlines are different than the others. So that's interesting, but it seems like the rest of the bills are moving as hoped. And so let's go back. Is there any questions about any particular bill that somebody wants information about? Okay. Yeah. Like I said, happily there seem to be moving along. I think there's only one that might be in jeopardy of not making the cutoff, and that's the one about treatment for PANDA or PANS treatment. So the big thing this week really is the budget. And on Sunday afternoon, both the House and the Senate dropped their budgets. And some, it's kind of the good, the bad, and the ugly, right? There's, the good news is, I think, Tammy, do you have a question?
Yeah. Is there any further update on the part about the physical therapy and for adults and
Yeah, let's talk.
yeah.
I'll talk about that in just a second. Thank you,
Okay.
Tammy.
Oh,
Yeah,
sorry.
that's really important. Really important.
Thank
So, yes. So the good news is neither the House nor the Senate included the changes to eligibility for long-term care services. We were exceedingly worried because that would have knocked about 2,500 people who have waivers in just in DDCS off of the waiver. That's almost 10% of the people on the waiver. That would have been really devastating. That is not in either the House or the Senate budget currently. So I think that's really good. The other piece that wasn't in there that we did not see was the cuts to early supports for infants and toddlers. And again, I think you all should pat yourselves on the back for your advocacy for those two things. We were told loud and clear that they had heard from the disability community. So pat yourself on the back, because both of those things would have been incredibly devastating. It's not over. And I'll talk in a minute about why it's not over. But for this moment, breathe a bit deeply. Okay, now let's look at the thing. So the bad is there still are a lot of cuts in DDCS. And, some of them are administrative and there's kind of a good news, bad news. The good news is those aren't really direct services to people, but it still impacts how you receive your services and the capacity. So, there's an administrative reduction. This one, we don't have very many people in assisted living, but there's an assisted living bridge rate that was reduced. Staff and lease costs, that's hard to quantify. Underspending in central office, and that still represents people that would serve you. And then cuts to field services, the number of people, the number of case managers, that would be cut to some extent. So those are things that, even though it's not direct service to you, you're not losing your services, it impacts the quality of your services. This one's a little concerning. Program underspend. They're saying employment day and family support, which is related to the IFS waiver, has cuts. And there's some questions about, and they said it was an underspend. There's questions about if those numbers are actually accurate, and there may be some pushback on that. Also in respite underspend, that's for enhanced respite and overnight planned respite. So it's really specific. That's not your regular respite from your waiver. That's additional, when you go out of home to have respite, or the enhanced respite is for families that have really need a break because their child's behavior. there's a couple of these things. There's things around behavioral consumer advocacy. That was something that was supposed to start. They're just not going to start it, I believe, yet, at least. I was a little worried when I had to read this one really close about 3 times because it says CMS eligibility changes, and I was freaking out about eligibility changes, but it's not. That's around the streamlining process around HR1, and it's not what I was worried about. There is some funding in the House, and I've got to go back and check in the Senate for non-citizens that would lose Medicaid for them. Some good news, there was money for what they call the SOLA forecast. They didn't, in the last budget, they didn't put the money in for SOLAs to maintain them. There wasn't budgeting, so they were a little bit lost there. So they both put that in, which is good. There's a reduction because they moved some of the stuff, this SOLA stuff from DDA over to the new administration, BHHA. So that's why there's a little reduction. That's just a reflection of the kind of moving budgets around. And there is money for 3 planned SOLA beds. That's not homes, that's beds, I believe. There is money to kind of for maintenance and a cut to maintenance and operations at RHCs. That's an unusual thing to see. Sadly, let's see, there's a whole bunch of questions I know. DVR, there's a reduction for the school to work program to align with current spending projections. So that's concerning. Let's see, I'm going to move down. There is cuts to child care, but I don't have those figures in here for the House and Senate. So we're happy. This is the big one. Here we go. The one we really don't like. So the budget in the House, not the Senate, would eliminate, not just reduce, but eliminate the coverage for adults on Medicaid for occupational therapy, physical therapy, and speech therapy. Just completely eliminate it. That's a huge thing. It's kind of a head scratcher because it's only $8 million in general fund, the state money, but they're going to lose like $33 million in federal dollars. That doesn't compute for me personally. I don't know what that means, but we know that therapy, people would come have surgery and they wouldn't be able to have physical therapy when they got home. They would have people recovering from brain injuries wouldn't be able to have therapies to help recover. So we know this is going to cost more in the long run. And our folks with cerebral palsy that need that ongoing physical therapy, any number of things, and they need therapy to learn how to use their communication devices, all those things. That's all there. There is, one small caveat that I'll say, you would still have some therapy on by using your your DDCS waiver, IFS. It's still a service there, but we know that's very limited. In IFS, that's just, it's for some people, it's like $1,500 a year. That's not going to go very far. And in the Basic Plus, it would compete with other things on your aggregate services. So if you needed community engagement or other things, you're going to be competing if you use your money that way. So that's just a small thing. Is like, well, you'd still have that, but it's still really a big deal. The hearing, the budget hearing on Monday, hundreds and hundreds of people signed in on this. So we think we need to make sure that people let their legislators know that this is not an acceptable cut for folks. So, yeah, it's worrisome. Deanna, sorry. Thanks for being patient.
Sorry, I had too many windows open. I couldn't find you. I was wondering if you had found anything about the family supports that were being cut.
So that's that piece up here where we go back up on that underspend. So we believe, let me find the right spot, where it talks about program underspend, employment day, and family support. We think that that's where they calculated out how much people don't spend using the IFS waiver. What's not spent.
Okay.
When people don't use their IFS waiver, and we are questioning whether that it's a realistic number or not. So it's concerning. Jim, you were looking for a one pager. We sent out an alert. Stacy, can you go to our blog and take the link from the blog about
I was just doing that. Just trying to find the right link.
Thanks.
Yes, I'll send that to you, Jim.
Yeah. And Claudia.
Hey, the proposed cut for OTPT and speech therapy, is that all Medicaid, adults on Medicaid, or just those with IDD?
All Medicaid. It's big.
Bananas.
Yeah, it's bananas. So the good news is that means we have partners that can fight this. It's not just us in the IDD community. We've got all the therapy communities, and we have other, the TBI community and other communities that are the aging community. We're all out in force about this. So I think we need to, again, to be loud and clear that this is an unacceptable cut. Christy.
Sorry, I couldn't find my mute button there. Hi, everybody. This is Christy. I just had a couple of questions in the Q&A. Is there an okay time to read those out?
Perfect. I'll stop sharing.
Perfect. Okay, I apologize. One from Layla came in a little bit ago. So the question is, what is the training partnerships rationale behind this? Is it only financial? And I apologize that it wasn't able to be asked in the moment. So I don't know if we maybe need more context for that question to be answered.
I think there's two things. I think they truly believe that training is important and they value it. But again, I think they also are, they don't want to lose, it's that money is rolled into the collective bargaining agreement. And I don't think they want to back down from their collective bargaining agreement. So, yeah.
Okay, thank you. So this is more of a statement than a question. There are hundreds of people waiting to receive services right now also.
Yes, we continue. There's still about 22,000 people, I believe, that don't receive any services from DDCS that are waiting for services. So that's continues to be, that population continues to grow greatly. And, it's concerning.
Thank you. All right. From Jen, I remind folks that the quote unquote school to work program label is misleading. 2022 Senate Bill 5790 is called an act to strengthen important critical community supports for individuals with developmental disabilities. There are many elements packed into 5790.
Yeah, it's very concerning. So, yes.
Okay. Yes. One more from Anonymous. I invite all people to be curious about what is meant by the underspend is because folks in DDCS don't even know.
I think that's good. A good point. Let's see. Yep. Okay. I'm trying to see if there's any other There's nothing in the chat box. So, okay. With that, I'll pass it back to Sean.
Yeah, this is something. I'm ready to play. So I have three parts to this. I'm gonna read the first part.
That provides therapy.
I'm sorry.
This is Sean Latham again, from Self Advocates in Leadership and a consumer of in-home care services. I hope you are having a great day today and you learned a lot. Today we learned that our state, like others, are facing a critical shortage of professionals with the experience and training necessary to support individuals with intellectual and developmental disabilities, I/DD. As our one-pager states, we have many types of workforce providers that we must protect. These include providers for behavioral health, childcare, education, respite, early supports for infants and toddlers, ESIT, local community programs, mental health, and direct care workers. As our population ages and we see better improvements diagnosing and serving children, young adults, adults and seniors with intellectual and developmental disabilities, it is clear that we will need to increase our provider pool by better recruitment tools, make sure we pay providers a living wage, make sure we invest in quality trainings, and I will personally add, make sure we match the right providers with the right individuals. When we don't see these improvements in our workforce, people with intellectual and developmental disabilities face many challenges that impacts their ability to live successfully in the community and puts us at risk of hospitalization or institutionalization. I know in my life and the life of my fellow SAIL members lives having quality providers that can help us with our education, employment and community life needs. Also, having direct care professionals in our home help us not only stay out of costly institutions, but also helps us reach our dreams. We need to fight each and every day to have a workforce that can help us with our personal needs and help us access things in our community. We want to live and thrive in our community. We do not want to live in hospitals, in nursing homes, in assisted living facilities, and in residential habilitation centers. Yes, we know we need temporary emergency or respite care at times, but we, like all human beings, desire to live in the community, and we deserve to have all of the services that impacts all aspects of our lives, which includes our providers that provides therapy services. So I ask everyone today to reach out and tell your legislators the following. We need competitive Medicaid rates to make sure we can recruit and keep providers that serve us. We need a strong specialized workforce that can provide services to a broad range of people with intellectual and developmental disabilities. We need equal access to experienced providers that can help us create a pipeline of qualified professionals. Above, we must fight to get our state and NATE to proactively invest in our workforce and not wait for times of emergencies to invest. When this happens, we can build a system that delivers quality, consistent care, allowing individuals with I/DD to live and thrive in their communities. And one last thing, as Kathy stated earlier, one other key way you can advocate is by voting in all elections. Your vote matters in your life and the life of your family members. Before I get to the end, I'm going to share our short video about how you can connect with your legislators.
So let me pull that up. Give me a second. Can people see?
Yes.
Okay. It's not playing.
Try again. You want me to? There we go.
Hi, I'm Sean Latham, the Policy Coordinator for Self-Advocates in Leadership.
And I'm Jessica Renner from Self Advocates in Leadership.
We want to thank everyone for taking your time out today to join us for Advocacy Days. We're here to talk to you about how to become a trusted resource for legislators on issues affecting your life. Even though your elected officials represent you, they can't do this very well if they don't know what you want. We want to encourage you to contact your legislators throughout session, but especially this week, about the issues that matter to you.
That's right. With so many topics to learn about, your knowledge of developmental disabilities helps them to do their job. You are the expert in telling your story and how it relates to decisions they are making. Here are some tips to help you make the most impact. Your time with legislators, staff, or aides is short, and your message should be too. When you communicate, sum up what the issue is and why it's important to you. Have a specific request related to a bill or budget item. Attack the problem, not the person. Follow up with a thank you. By doing this, you greatly increase your credibility and strengthen your legislative relationships. Bottom line, stick to what you know, which is your life, and how the issue affects you.
Here are some ways that you can reach out to your legislators. You can email them and their legislative assistant about your priorities. You can contact them through the legislative hotline phone number, which is 1-800-562-6000, and ask to leave a message for them. You can also share your opinion on a particular bill by using the hotline. We also encourage you to request either an in-person meeting with your legislators or a meeting with them over Zoom or Microsoft Teams. Please reach out to the legislative assistant of the legislator to request a meeting. You can watch the legislature at work on TVW, either on your TV, if you have the channel, or online at tvw.org. Another way you can participate is by signing up to testify at legislative hearings. For each hearing, you can sign up for the individual bills as pro, meaning you are for the bill, con, meaning you are against the bill, or other if you have concerns with the bill you generally like.
Let me now take you through the process using the Washington State Legislative website that can be found at leg.wi.gov. On the website, under the menu, click on the menu item that states Bills, Meetings, and Session. From there, scroll down to the section titled Upcoming Committee Meetings and click on the link titled Sign into a Committee Meeting. Next, choose if you are testifying in a House hearing or testifying in a Senate hearing. We all have the choice to testify in person, testify by video remotely, or we can submit written testimony or just state what our position is on the bill.
After you pick one of the options, you will be taken to the form to register. You will need to fill out your position, your name, your email, your address, your phone number, and your organization, if you are representing one. It also asks you if you will testify on a panel or not. If you are testifying on a panel, it will ask you to fill in the names of the other panelists. The other box to make note of is the pronunciation box. If you want your name said right, you can sound it out in that box. Please check the box "I'm not a robot" at the end of the form, and then it's time to hit Submit Registration. Once you submit your registration, you will receive an email from a committee staff email address. Please read this email carefully and add the meeting to your desired calendar using the links in the email. From there, make sure you are ready to testify.
Don't forget about social media. A lot of legislators have accounts on Facebook and Twitter where you can comment or watch live stream chats and virtual town halls.
It's so important to stay informed and involved. Participate in virtual advocacy days. Sign up for the Arc of Washington's action alerts. Get updates at arcwa.org and follow on Facebook. Connect with local parent and self-advocate groups. And remember, change is made by those who show up.
Amen. Hallelujah.
As we advocate for our favorite bills today, I wanted to tell you that you can visit the legislative website and see what bills are coming up for a vote on the floor and what bills are getting a hearing. Just go to leg.wa.gov. And please check out the TVW website to see the House and Senate in action at tvw.org. Hearings are going on all day, so please watch the hearings that interest you. For more information about the issues you heard about today, we are going to post this week's one-pager in the chat, and please see the ARC's bills of interest for additional information. Lastly, I want to encourage you to fill out our Advocacy Day survey. This helps us understand what you like and what you didn't like about Advocacy Day, so we can get better and better. You have the option of filling out the Zoom survey that you should see on the screen now, or alternatively, you can click on the links I posted in the chat. There will be an English and Spanish link. Let us know after if you need any assistance in filling out the survey. With that, I will thank everybody for coming today, especially our great speakers, and my co-facilitator, Emily. A few of us will stay for a few minutes after, if people have questions, and remember, change is made by those who show up. Thank you. Thank you.
Thank you. Just a quick note, I just got an email that the 1795, the Restraint and Isolation Bill, just moved out of committee. So that's good, and apparently with no scary amendments. So good. A little celebration there.